Hi, everyone. Thank you so much for joining us. My name is Dr. Anna Liscano. I'm a psychologist and I use she, her pronouns.
Hi, everybody. My name is Dr. Caitlin Sorensen, she, her pronouns. I'm also a psychologist, and we both work at mental health and counseling.
Yes, today we're going to talk a little bit about COVID and being isolated and quarantining and kind of checking in with yourself in terms of what's normal for stress, anxiety, mood changes, and what are some things maybe you should look out for.
Absolutely. One of the things that we know about COVID quarantine is that some people are going to have a hard time with it. It's a stressful experience. It can be lonely, it can be isolating. People can have a lot of worries about their health and the health of the people around them and the health of their loved ones, as well as worries about how this is going to impact their academics and their social life during the semester. So, we're going to talk today about kind of what to expect during this period and also what to look out for, signs that are more concerning.
Absolutely. And I think it is important to kind of mention too that everyone's kind of going into this semester and dealing with COVID with different levels of already feeling stress and anxious or mood disorders or fluctuations as well. So kind of checking in with yourself and knowing that it could be different for everyone and seeing what your baseline is and if it has changed is important.
One of the reasons why we want to encourage folks to self-monitor their mood while you're in quarantine is because quarantine is hard, and so everyone is entitled to a few hard days, right? We might have times where we just don't really feel like dealing with it, or we just kind of want to watch TV all day, right? Everyone's entitled to some, down days in life. Life is full of hard things, and COVID brings up feelings of loss and sadness, and that is normal and to be expected. But what we want to be looking for is sort of the trend line. Are we particularly down and staying down day over day? Is the mood kind of like having more normal fluctuations, or are we seeing kind of a downward trend that's more concerning?
Right. So kind of like you would typically with your normal body temperature, kind of taking your temperature a couple times a day to see how you're doing. This is kind of similar thoughts with your mood as well. So being able to check in with yourself a few times throughout the day and then getting the overall trend, I think is very beneficial for everyone.
Sometimes I like to think about it like, why do we check the weather in New England? We check the weather outside because it changes all the time.
All the time. Yep.
We want to be prepared. And that's why we have to check the weather on the inside too, because it does change all the time and we want to be prepared. So if we notice that we're having a particularly low mood day, we're feeling more hopeless, we're feeling more tearful, if we know that, we can prepare by getting some extra support, reaching out to friends, doing more pleasurable activities during the day. So when we check in with ourselves, we have more information to make better decisions about how to help ourselves.
Right. Absolutely. Knowing kind of how to respond before you're in the situation can be very helpful. So that'll be part 2 of this, the next video.
So Dr. Lascanzo is going to tell us a little bit about how to self-monitor for depression. What does depression look like and how to know if that's what's going on versus just kind of normal, periodic moments of sadness or loss.
Absolutely. Right now, I think it's true that all of us have been adjusting a lot and to many different transitions these past several months, and especially these next few months as students come back to campus and we're still dealing with COVID. It's also challenging too to kind of check in with yourself and try to monitor for depression and trying to see how you're feeling because some of the symptoms overlap too with being physically ill. So some changes in energy levels, somatic complaints like headaches or stomach aches, changes in sleep or eating habits, and being more withdrawn from normal activities, friends and families. These are expected with COVID, but is also overlapping symptoms with depression. So some other symptoms maybe to kind of look out for a little bit more are feelings of sadness, tearfulness, hopelessness, increased irritability, difficulties concentrating, and it is something that, again, is typical to be experiencing some of these feelings every day. But kind of checking in with yourself to seeing how often is this happening? How am I managing it? Is it interfering significantly with my life right now? My ability to feel connected to others, my ability to feel like I'm able to do the things that I once really enjoyed doing and really love doing, like reaching out to people, any particular hobbies that you can still do while you are isolating. And if there's any particular thoughts of suicidal ideation or self-harm behaviors or anything like that, that's absolutely our number one concern and the main thing that we want to make sure that people do reach out for help for.
So there's lots of ways to self-monitor. You know, it can be as simple as just a scale from 1 to 10. You know, how am I feeling on a scale from 1 to 10 today versus tonight versus tomorrow? We could use something like the COVID app. Also on this site, there's a video orientation of the COVID app called COVID Coach, and that has a mood tracker built into it. So you could just do it right there on your phone. And Dr. Lascano is going to show us a kind of objective measure that is really commonly used, and it's a pencil and paper test.
Yes, definitely. So this is the Patient Health Questionnaire 9 or PHQ-9. This is very widely used to try to monitor for mood and see how you're feeling. There's about like 9 questions, not too bad to kind of go through, but some of the most important ones to maybe kind of look out for again are you losing the sense of pleasure or interest in things that you once enjoyed doing and can still potentially do during isolation, but you just don't find as enjoyable anymore. So, for example, if you really enjoyed watching a particular movie or TV series and you're just not finding the same joy that you used to have anymore, maybe kind of take a little bit of a look in that, as well as like reaching out to friends or families, reading, any kind of activities like that. The other one, like I mentioned, that we should be particularly looking out for is number 9. If you have any thoughts that you will be better off dead or hurting yourself in some way. These sort of questionnaire is not used for self-diagnosing oneself. It's more used to then be able to bring to a mental health professional and get the appropriate care and diagnosis need.
Exactly. And, you know, just lastly, hopefully everybody by now knows that mental health and counseling operates a 24/7, 365 on-call emergency crisis line. So if you are feeling really bad and you're having kind of an acute moment of crisis, you can always reach out and get some support right then and there. Thank you everybody for joining us today to talk a little bit about what is normal during COVID and also how to self-monitor for more concerning symptoms of low mood. Our next video is going to talk a little bit about strategies for getting through it and tackling this tough time. Thanks for joining us. We'll see you next time.
Thank you. Bye.